I want to share a story with you. It's about painful, unconscious emotions that fuel the psychosomatic process. I want to spread awareness about mind-body illnesses. With this story, I invite you to think about yourself, look inside you, and think about if there are any repressed emotions inside of you that could have caused your pain, your physical pain in the body. There's no question that unconscious emotions are the foundation of the psychosomatic process. It has been my experience that any painful unconscious emotion can be psychogenic, since it can be threatening to us and those we naturally want to defend against it. Anger or rage is a common emotion that warrants our defenses, but usually is a response to repressed emotions such as shame, guilt, feeling unwanted or inadequate, sorrow, fear, and insecurity. A 36-year-old woman with a past medical history of migraine headaches and an anxiety disorder developed neck and bilateral shoulder pain 4 months after the delivery of her first child. She attributed the pain to holding her son. It improved after a course of physical therapy, which was about the same time she returned to work as an accountant. 18 months later, she gave birth to a second son and decided to quit her job and stay home with her children. She began experiencing intermittent neck pain again and also had a marked worsening of her migraine headaches. 6 months later, her mother, who had been diagnosed with lung cancer, died unexpectedly. Her mother had also been an alcoholic, and the patient had experienced frequent outbursts of anger from her mother as a child. She had also become increasingly concerned about her husband's drinking, although she had not discussed it with him or anyone else. 3 weeks after her mother's funeral, she developed increasing joint pain, generalized aching and fatigue. She hurt everywhere. After several physician visits, she was diagnosed by a rheumatologist with fibromyalgia. Due to the disabling nature of her pain, she required childcare during the day. This patient harbors many difficult emotions related to her childhood, including emotional abuse from an alcoholic mother. These repressed emotions, along with the pressures of becoming a new mother, triggered her neck and shoulder pain that improved with the distraction of going back to work. The added pressures of a second child, combined with the decision to stay at home with them, stirred up her repressed emotions further, as evidenced by the return of neck pain and the worsening of her migraines. Finally, her mother's death became too much. Not only did she lose a mother, but her death triggered many of the repressed emotions stemming from her childhood emotional abuse and her mother's alcoholism. The icing on the cake was her husband's drinking. Unconsciously, her evoked emotions felt like they would be too much to handle, rightly so, and thus required drastic symptoms to adequately defend against their threat of expression. Patients who were physically, emotionally, or sexually abused often experience a lifetime of physical pain rather than having to grieve and experience the unbearable emotional pain that became repressed in childhood from their awful experience. This is an example of the symptom imperative, the need to have physical symptoms, often and ongoing, in order to keep one's emotions repressed and well defended. to emphasize again, I have found that the severity and chronicity of one's symptoms is proportional to the underlying pain that harbors in the unconscious and the triggers that evoke them. It is common for patients or physicians who understand the true cause and thus the appropriate treatment of psychosomatic disorders to want to tell their friends or acquaintances about their disorder and how to successfully treat it. They are often met with resistance. I can recall giving a talk about the mind-body connection of fibromyalgia to a group of 400 people with this issue, a particularly severe manifestation of TMS. These were people whose symptoms were disabling and consuming, but not one person was willing to see their problems as psychosomatic. Ironically, this makes perfect sense. If one acknowledges that his disorder is psychogenic, then he is acknowledging those painful unconscious emotions. He is shedding his defenses and thus his distractions. Consequently, he would begin to feel emotional pain. For many, this would be too much. It would be easier to have their physical pain than to begin to feel those emotions that have been repressed for good reason. Of course, this thought process is not conscious. I will tell those patients that I treat with Dr. Sarno's methods that it may be an emotional, painful process. It's not easy to acknowledge that these powerful and painful emotions reside within us. That's why they have been repressed. I vividly remember a patient that I treated for chronic low back pain several years ago. She had great insight into the concept that her pain was distracting her thoughts away from those painful unconscious emotions. However, when her back pain resolved, she was, as she described it, an emotional wreck. She was able to flip the switch between having back pain or struggling with her emotions. In the end, it was easier to have back pain. We should not forget the power of these emotions. For many, it is easier to suffer physical pain than it is to acknowledge the emotional ones. Furthermore, our society is not supportive of expressing those painful emotions we all harbor. As I noted before, we are a society that is uncomfortable with crying or grieving and view those who become overtaken with emotion as weak. It's no wonder we often feel alone with our emotions and desire to keep them repressed. There's often no support to help grieve life's disappointments, challenges, and losses that we all experience as human beings.